Alrighty, I think we'll roll. I'm Liz Boyles, and I'm with the Keep America Safe Coalition. Thank you so much for joining us today for this webinar. This is a coalition that was formed earlier this year in response to proposed cuts to the CDC Center for Injury Prevention and Control, and it's organized by Safe States Alliance. The coalition brings together over 40 organizations from across the country that have direct interest in preserving the injury center. We are a group of leading health organizations, research institutions, and agencies who've aligned to protect and preserve the injury center. And the mission is to educate and inform policymakers about the center's unique and critical role in preventing injury, suicide, and overdose in America. We're going to put up a poll in just a moment because we'd love to hear from all of you about how you currently interact with the injury center. Bringing together different voices who interact with the center in different ways is a key component of this campaign. So if you could just take a moment and fill that out, that would be super helpful. Thanks again. Alrighty. So today we're going to hear from the leadership of the coalition and some key partners. You're going to hear from Sharon Gilmartin, who is Executive Director of the Safe States Alliance, Allie Maffey, Vice President of Social and Behavioral Health with the Association of State and Territorial Health Officials, Paul Banta, Director of Government Relations at the Safe States Alliance, and Carlos Roig, who's part of the Keep America Safe team. Our agenda today, we're going to get through a lot and we're going to do it quickly to get you all looped into the campaign. Sharon is going to first give you some background about the Injury Center and why this coalition was organized and start to talk to you about how you can plug in. Allie is going to talk to you about why ASTO joined the coalition and how ASTO is working with the Keep America Safe Coalition to engage ASTO members in this campaign. Paul is going to give you some insights about the state of play for the Injury Center, policy-wise, funding-wise, and give you some insights into what the government relations team is working on. He's going to give you information on key messages for this campaign and how you can carry those messages to key audiences through your own channels. And then Carlos is going to talk to you a little bit about the key importance of storytelling for this campaign. We've been told repeatedly by stakeholders that stories are super important, and bringing those to policymakers is essential to our success. But we're going to need all sorts of stories from all over the country, and that's where you come in. Okay, we can take a look at those poll results quickly and get those up on the screen. Interesting. Okay, great. So we've got a wide variety of folks on the call, but it sounds like a lot of folks are using data from the Injury Center in their work. And we've heard that time and time again. And we do have a lot of folks who are doing work directly on the issues of suicide, overdose, and injury prevention in communities, which is wonderful. Those are the kinds of stories that Carlos is going to talk to you about a little bit later, is community-based ones. Okay, before I hand over the mic to Sharon, I'm just going to go over a little bit of housekeeping. We are recording this webinar today, and you will get a copy of that recording via email after the webinar is over, so you don't have to madly take notes if you do not want to. We're also going to email you links to key documents that we're going to talk about during the webinar today, such as key messages. And we're also going to have time for questions from all of you, and we would love to engage with you at that time and answer any questions you have. Please ask your questions through the Q&A box, which is just at the bottom of your screen. You might need to hover your mouse for a second on the bottom of your screen in order to see that menu pop up. Please ask your question and let us know what organization you are from as you ask. That would be super helpful. If you have technical difficulties at any time during this webinar, just hit the raise hand icon at the bottom of your screen and someone on the staff will reach out to you to resolve it. All right, thank you so much again for joining us. We know you all are busy. I'll hand it over to Sharon.
Well, thank you, Liz. Good afternoon or morning, depending on your location, and welcome. I'm Sharon Gilmartin. I'm the Executive Director of the Safe States Alliance. And first, would like to start with thanking you for being here, for the work you're doing every day. We know that this work is essential for keeping people safe and healthy. If you're not familiar with Safe States, we're a nonprofit and membership organization of over 800 professionals working across public health departments, hospitals, academia, community organizations, you name it, we're there to prevent injury and violence. We recently launched this campaign and the Keep America Safe Coalition to protect the CDC Injury Center from cuts or elimination. And truly, our success depends on how deep and wide we can build this coalition. Many of you have asked various members of our team, have come online to say, how can I help? What can I do? So today, that is what we're going to dig into. So first, let's start with some important context about the CDC Injury Center. This is also known as the National Center for Injury Prevention and Control. You'll hear it referred to as the Injury Center, NCIPC. All of this is the CDC Injury Center. Established in 1992, it has led the nation's public health response to both unintentional and intentional injuries. It was great to see in the poll how many of you are partners of the Injury Center and just how it helps inform the work that you do. I don't think this really applies to many of you, but for anyone not familiar, the Injury Center, grounded in science and public health practice, it collects national data, identifies risk and protective factors, develops and scales prevention strategies, and focuses on all kinds of injury and violence prevention issues. We mentioned overdose and suicide prevention, to name a few others: traumatic brain injuries, falls in older adults, sexual and youth violence, adverse childhood experiences. I could go on and on. So in this campaign, we are going to be telling people who are less familiar with the Injury Center what that work is. And we need to let them know what we already know. So whether it's reducing traffic fatalities, preventing falls, addressing child injury prevention, or tackling any of the other issues that I listed and others, the Injury Center has provided the funding, the research, and the resources that our communities need to face these pressing issues every day. And that is what we need to convey. So our bottom line is that their work supports efforts across the country to improve health outcomes across each and every one of our communities. So in FY25, actually in FY24, the House Labor HHS Appropriations Committee proposed eliminating the CDC Injury Center's funding entirely, $761 million in total. The Senate didn't allow these cuts to move forward, but this was a wake-up call for those of us in the field because it revealed a significant lack of understanding in Congress about what the Injury Center does and the value that it brings to states and communities. So here are some things that we know, and we already just mentioned this. These issues touch everyone. The Injury Center plays a critical role in preventing overdose and suicide, two of the most urgent public health challenges that we face today. An American dies by suicide every 11 minutes. 1 in 3 adults has lost someone to overdose, but it's not just overdose and suicide. It's drowning and brain injury and all of those other preventable outcomes that we've referenced. For those unfamiliar, in the United States, injury is the leading cause of death of children and adults ages 1 to 45 and costs over $4 trillion annually, which directly affects our workforce health, our community stability, and so many other indicators. Paul will talk more about this, but when we set out to launch the campaign, we identified overdose and suicide as our key focus areas for the campaign to lift up because they're bipartisan issues that touch everyone and where we are seeing marked progress thanks to CDC support. Their overdose data to action program has delivered hundreds of millions of dollars to 90 jurisdictions, and suicide prevention programs are active in 24 states, prioritizing high-risk groups like veterans. And we know that the programs are working. Everybody has heard the provisional data at this point that overdose deaths dropped by more than 25% from September 23 to 24. And we're expecting to see the same numbers when they move to the full calendar year. And yet, despite this progress, despite bipartisan support for these issues, the Injury Center was zeroed out by last year's Labor HHS Appropriations Committee in the House. And last week, we saw in the skinny budget that was released that President Trump called for the complete elimination of the Injury Center in his budget proposal. If eliminated, this means we would lose our nation's most comprehensive data systems for tracking trends in injury and deaths, and states and communities would lose critical funding that supports evidence-based prevention programs. And I want to lift up that point. 80% of the CDC Injury Center's funding goes directly to states and communities. If these funds disappear, so do the systems and services that help our families, that help our veterans, that help our first responders across the country. So that brings us to the campaign and the reason that we're here today. To respond, Safe States launched the Keep America Safe Coalition. Like Liz mentioned, this is a growing alliance of nearly 40 national and community-based organizations advocating for sustained, robust investment in the Injury Center. The coalition recognizes the irreplaceable work that the Injury Center leads and is collectively joining forces to defend it. Our mission is to educate and inform policymakers about the Injury Center's unique and critical role in preventing injury, overdose, suicide, and so many other preventable outcomes. Paul will share more details about how we're using policy advocacy, public awareness, and community engagement to lift up this effort and influence decision makers. And this is where you come in. We need your help. We need your help in communicating with members of Congress about the need to preserve funding for the Injury Center. We need your help to tell this story through data and lived experience and local examples. And suffice it to say, we simply cannot do this alone. I am so grateful to see the incredible turnout that we have here today, and to see all of you joining us in this effort. So today, like Liz mentioned, we'll walk through the campaign strategy and outreach tools, and we hope that you'll leave not just informed, but inspired and equipped to advocate for the future of injury and violence prevention. So with that, I thank you for being here, for your unwavering dedication to public health. And now I will hand things over to Allie Maffey with the Association of State and Territorial Health Officials. So grateful to have ASTO as part of the coalition, and thank you, Allie, for being here today.
Thank you so much for giving me the opportunity to share a little bit about why this is such an important issue for ASTO and why we joined this coalition. For those of you who don't know, ASTO is the membership organization that represents the lead health officials across the United States, DC, the territories, and the freely associated states. We joined this coalition to defend funding for a public health approach to preventing these important outcomes. We know that treatment is not enough and that we must work upstream to prevent these issues. ASTO conducts regular environmental scans of the top priority areas for all of the state and territorial health agencies across the country. And year over year, behavioral health topics like suicide, mental health, and overdose prevention consistently rank in the top 5 priorities for these agencies. Complex problems like these require comprehensive solutions that include prevention, not just treatment. These solutions require funding for strong data systems that inform prevention approaches, improve access to care, implement life-saving interventions that work for families, that work for communities, for schools, healthcare systems, and beyond. So as you heard from Sharon, 80% of the funding to CDC for injury and violence prevention comes through to states and communities just like yours. This work is happening at your doorstep funded by the CDC, and it's vital to the successes that you've had so far and the successes you continue to hope to see in the future. So we do need your help elevating the stories of success about the many ways that these prevention dollars have helped create systems and communities that work together to prevent these leading causes of death for Americans in the first half of their life. So Paul is going to talk a little bit about some of the key states. If you are in those states or if you have partners who can speak to these issues, please be in touch and start to elevate those stories of success of what your community has been able to do.
Great, thanks so much, Allie. Now we're going to hear from Paul Bonta, who's Director of Government Relations at the Safe States Alliance. Thanks, Paul.
Thank you, Liz, and thank you all for being here today. I'm going to spend the next few minutes talking through the campaign's congressional outreach strategy aimed at protecting the CDC Injury Center and how you all can get involved. So let's just quickly review the primary objectives of this campaign, and that is to communicate that to highlight, I should say, that the CDC Injury Center is the leader on preventing overdose and suicide, that its work is irreplaceable and saves lives, and that Congress should fully fund its work. The Injury Center has already experienced substantial staffing cuts since the start of the new administration, and as Sharon noted, the president's budget request to Congress, which was released just last week, proposes to eliminate all funding and all programs administered through the CDC Injury Center. So your voices and your stories are critically important to help illustrate the value and the impact that injury center programs have in the communities where you live. So let me give you a sense of what we've been working on. We have worked with our champions in Congress to circulate a Dear Colleague letter to the leadership of the House and Senate Appropriations Committees, urging that they provide a robust investment in injury center programs in the fiscal year 2026 budget. I'll talk a little bit more about the Dear Colleague letter in just a bit, but we also recently led a sign-on letter to Secretary Kennedy, noting the coalition's opposition to the recent staffing reductions at CDC. In addition, we've been active in the media, highlighting the work of our campaign, including interviews and a letter to the editor that was published in the New York Times. Now, the next part of this strategy is where you all come in. We're organizing a grassroots effort aimed at illustrating for members of Congress how important CDC Injury Center programs are. We're focusing our efforts on Republican members of the Senate Appropriations Committee. As Sharon noted, last year, the House Appropriations Committee approved its labor HHS appropriations bill, which proposed to zero out funding for the Injury Center. So that means we're expecting for the House Appropriations Committee to do the same thing this year. So as a result, our targets for this campaign are Republican members of the Senate Appropriations Committee. Why? Because they really are the best positioned to push back on anything we see coming out of the House Appropriations Committee. In addition, we're also targeting members of a new CDC working group that Senator Cassidy from Louisiana recently announced and which he is chairing. So as you can see, we have a lot of senators on these committees who we're targeting and who represent states that were hit the hardest by overdose and suicide. But if you live in these target states, your voice, your story is critically important. However, if you don't, we still need you to engage with us. So let's talk about our policy focus areas. As Sharon had mentioned, this campaign decided early on that we needed to focus on those injury and violence prevention issues that have traditionally garnered Republican support or bipartisan support. Obviously, overdose prevention, veterans health, suicide prevention, rural health are issues that are of importance to many Republican lawmakers. But we also know that there are other bipartisan injury and violence prevention issues that are equally important and that should be highlighted as well. Issues such as traumatic brain injuries, sports concussions, issues that are relatable for families and communities across the country, and importantly, relatable for families that support staff working on Capitol Hill or support lawmakers who are in the House or the Senate. As I said earlier, if your issue isn't one that appears on this slide or isn't one that I highlighted, it doesn't matter. We still need everybody's engagement. Even if your work doesn't focus directly on your issues, we need a diverse set of voices and expertise that will be key to communicating the wide-reaching and critical role that the Injury Center plays. So let's talk through our key messages that we want to deliver to Congress. Obviously, when it comes to injury and violence prevention, there's a lot of negative news that we could focus on, but we want to lead by creating a positive message, a positive vision for the future. We want to make sure that we establish that this vision is attainable, that these deaths can be prevented. We want to show that the goal is attainable if we have a plan. So we also want to talk about our leading solutions. Sharon already mentioned, Ali also reinforced the point that 80% of dollars that are appropriated to the CDC Injury Center flow directly to communities who know what solutions work best for them. We also want to highlight that overdose prevention is a priority for President Trump. So we need to show that there's progress on overdose and that we can't stop this momentum. So between September 2023 and September 2024, we know that overdose deaths nationally have declined by over 25%. That statistic also points to the work of the CDC Injury Center because it is thanks to CDC Injury Center data collection and surveillance programs that we know overdose deaths have been in decline. So let's talk a little bit about the Injury Center's role and the fact that its work is irreplaceable. We heard from congressional champions on Capitol Hill that as they go into negotiations with staff on the other side of the aisle, they are increasingly hearing that there are some offices that believe that injury center programs are duplicative and that they could just simply be picked up and moved to another agency. And so they encouraged us to work with our grassroots advocates to head off that notion, to communicate the comprehensive data systems and research capacity that is truly unique to the Injury Center. Many of you on the poll at the outset of this webinar noted that you work directly with many of those data systems, so you really are the best positioned to be able to communicate the value of these data systems, the best position to educate Republican senators as to why that is expertise that lies solely within the CDC Injury Center and not within any other federal agency. We have to communicate the specialized expertise and the leadership that exists at the CDC Injury Center and their effective partnerships that lead to community-based impacts across the country. So this is the most exciting part of this webinar. This is where I get to highlight our call to action. And so ultimately, we want members of Congress to protect the $161 million in funding that has been allocated to the CDC Injury Center and that represents today's level of funding for the programs that they administer. As I mentioned earlier, our champions in the House and the Senate are circulating a letter in their respective chambers asking that their colleagues sign on in support of a robust investment in the Injury Center. So when the president releases his budget request, or submits, I should say, his budget request to Congress, that's what typically kicks off the annual appropriations process. And so during the appropriations process, all members of Congress are working behind the scenes to try to build support for the areas, the programs, the issues that they care about most. And so for these Dear Colleague letters, it's critically important that we collectively do everything we can to get as many members of Congress to sign the House Dear Colleague letter and as many senators as we can to get to sign on to the Senate Dear Colleague letter. The more members of Congress that sign each letter, the greater weight that that funding request will carry with appropriators once they start drafting their bills. That's why it's critically important that you contact your members of Congress to make them aware of these letters and to ask that they sign on. Because, as you can imagine, with 435 representatives in the House, 100 senators in the Senate, all working to try to promote their primary issues or programs of interest, there are literally hundreds of Dear Colleague letters circulating on Capitol Hill right now. Members of Congress rely on their constituents to point them to those letters that deserve their support. And that is why your voice is critically important as a constituent and as a voter for both of your senators and your representative. Unless you engage and unless you communicate to them that there is a Dear Colleague letter aiming to support the CDC Injury Center, they will never know that that letter is circulating. So I want to also quickly congratulate our colleagues at Brass Ring. They have done a tremendous amount of work behind the scenes to set up this action center with the goal of making your engagement in this campaign as easy and as seamless as possible. So we have a link in the chat to the Action Center, which you can access. And you'll see that in that Action Center, you'll have the ability to contact your member of Congress using either a phone script or a letter template or an email template. We have state-by-state one-pagers and talking points that you can use in your meetings with lawmakers. We have draft social media and newsletter text that you can use to update your networks about the campaign. I also want to quickly note that meetings with lawmakers don't always require travel to Washington, D.C. All members of the House have offices back home in their congressional districts. All members of the Senate have multiple offices back home in the states that they represent. And constituents have increasingly been scheduling visits with their lawmakers while they are back home in their states or their districts. So that's an easy opportunity to use some of these materials, meet with your lawmaker while they're back home to communicate the important role that the CDC Injury Center plays in injury and violence prevention. If you're hosting a Hill Day or any other mass action grassroots event for your members, reach out to me. Here's my email address. We'd love to have an opportunity to partner with you. We'd love to have an opportunity to co-brand materials for your members, for your advocates. Yet I need to note that there is an important deadline coming up, which is May 16th. I ask that you complete this work by May 16th because that is the date in which the House and Senate Dear Colleague letters will close. So I believe this is the point where we have a poll. As I said, we're asking you to do this by May 16th, and we ask that you sign up to take at least one of these actions. And if possible, we would encourage you to sign up to do more than one. So let's go to the next slide. So as you can see, if you've accessed the Action Center, there are two buttons there that you can press on. One is to contact your federal representatives. That will take you to a webpage where you can send an email directly to your members of Congress urging that they sign on to the House and Senate Dear Colleague letters. The other contains a social media toolkit that you can use to help spread the word about the coalition. I mentioned the state-specific one-pagers you see down there at the bottom of this slide. These are incredibly helpful resources that we have been using that I'll share with you all. Congressional staff have said that they appreciate because it highlights the programs that are funded in the states and the congressional districts that their bosses represent. We have a link there that will allow you to download talking points and a handout that you can use when you meet with your lawmakers or their staff. We also have a link to a phone script or to a grassroots software package that will allow you to email, as I said, your two senators and your representative. Again, the goal of this Action Center is to make this as easy as possible for you all to engage in this campaign, for you all to lend your voice, and to help educate lawmakers about the important work that the CDC Injury Center does. So I mentioned the social media toolkit. Perhaps I jumped the gun. So here we have the social media toolkit. And there's great information there, text that you can use for your LinkedIn, for your website. For those of you who work directly on injury center funded programs and know the importance of expanding and strengthening the voice in support of the injury center, this is a great way to promote what you're doing through, as I said, your social media channels and the website. We also have a link that will take you to a badge that you can post that will allow others in your network to become aware of the coalition and to also join if they would like. So I should mention that we are aiming to bring this group back together on June 3rd at 2 p.m. Eastern time to hear from you all about your experiences in reaching out to lawmakers, to hear from you all about the work that you are able to do in order to build support for the Injury Center, in order to educate members of your congressional delegation about those injury and violence prevention programs that you care about most. We will also obviously share with you the list of signers that have joined the House and Senate letters. I'll note that last year we had just over 100 members of Congress who signed on to our Dear Colleague letters. And so this year, particularly given the attacks on the CDC Injury Center, we really truly are looking to blow right past the level of support we received last year. But we need your help. We need your engagement to do so. So we hope you'll join us on June 3rd at 2 p.m. Please feel free to click on that QR code where you can register for that June 3rd webinar. So before I turn it over to Carlos, I just want to reiterate the importance of your emails, your letters, your ability to recruit others to join in this campaign. Here are the results of the poll. Thank you for those who have agreed to take action. Sending letters to members of Congress is exceedingly important. It's one of several opportunities constituents have, not only to engage in the policymaking process, but to make your voice heard. So thank you for doing that. We look forward to hearing about your experience on June 3rd. And as I said, you all, as injury and violence prevention, either professionals or beneficiaries, or just community-based advocates who are interested in helping to support the CDC and protect the CDC Injury Center, your engagement, your voice, your storytelling, you all are the best positioned to engage with us and to educate lawmakers about the need to support funding for the CDC Injury Center. So with that, let me turn it over to Carlos, who will talk a bit more about our storytelling component of the campaign. Thanks, Carlos.
Thank you, Paul. I really appreciate it. And I think it's notable that every speaker that preceded me has used the word story or stories at some point in their conversation. It truly is a central part of this coalition and this campaign. So what do we mean by when we say stories or storytelling? You know, it may conjure the idea of a storybook or story time for kids. And while that's not what we're doing, this idea really is applicable and instructive as you think about the stories that you might have that could be shared. So what connection does this have to the way that we tell kids stories? Really three things I want to call out. One is that these stories are designed to hold attention, to grab attention and to hold it. The second is that we want any stories that we do as part of this campaign to explain things very clearly and very succinctly. And then lastly, we can tell stories using words, using numbers, using images, or using all of them together. So as you think about the types of stories that we might be seeking, and when we talk about storytelling, there really is this connection to the way that we communicate with children's stories, but applying this to something that's very significant and important, of national importance. So if we go to the next slide and we think about what kind of stories might we be interested in telling, We really want to feature benefit and impact at the state and local levels. So we want you to be thinking about ways in which you've seen things play out where real people are affected in real ways. These could be hospitals, state, local health departments. It could be nonprofit organizations that run programs. But really, a central component of this is about the people that are served. So, a few elements of stories. We're looking for real people, real words, and real impact. Again, getting back to that notion of clear and succinct articulation using words, numbers, or images. We want a human element whenever possible. Think about emotion that plays out in injury prevention. Think about families that are affected. Think about communities that are affected. You may ask yourself, well, what about stories about data? Great. We love numbers, but we always want to get to the people behind the numbers. We want to use that number to help lead us into a story of real people that were affected in real ways. How about acronyms? You would almost think that the entire public health infrastructure would fall apart if we took away acronyms. Acronyms are fine, but we need, again, the people behind those letters. So there may be programs out there that you know of that you talk about with acronyms. That's fine. We just want to deconstruct those and get to those stories of real people affected. Some of the stories we tell will be stories of success. Some may be stories of pain or loss, and other stories may be those of resilience and perseverance. We really want to think broadly about the types of stories we tell, but we know they could have any of those components. And I think what we're getting at too is that if you have any doubts, let us help you. Let us work with you. For the right story, we can find the link to the Injury Center, but we're also happy to listen and talk about the kernel of a story that you think you might have, and we can find ways to help elicit the crux of it and the way that it connects. So where are we looking for stories? We mentioned before the Senate committees and other groups that we're looking at. We're really ideally trying to find stories in these 17 states because we can then use those to communicate directly to those members of Congress about people affected in their districts, in their states, et cetera. That being said, if you have a great story that maybe isn't from one of these 17 states, don't hesitate to let us know, because we might be able to stitch it together with something else and be able to make that connection to other target states. So if we move on, want to talk a little bit about how we go about telling these stories. We tell them in a variety of different ways and in a variety of different platforms. So earned media, certainly using these stories as a component of our media outreach and engagement. That can happen across print, broadcast, digital. It can be local, national, where we can take that story, pair it with an expert in the field, and turn that into earned media coverage. We can use it for opinion pieces, so think op-eds or letters to the editor in national and local publications. Again, capturing someone's voice, telling their story, but also making a case for a policy move that we think is important or funding that we recognize is critical. We can tell these stories in digital, across social media, emails, websites. Again, I'll show some examples of types of stories, but a story need not be 3,000 words. It can be one sentence. It can be a single quote. It can be a powerful image. And then lastly, persuasion on Capitol Hill. Stories like these can be nested into leave behinds, can be used again in email, or once internalized, they can be used verbally in meetings to be able to point to a very specific person in a very specific place that was affected in a very specific way by this type of funding or these types of programs. So a couple quick examples. If we look at a recent piece that published in March in the Washington Post, this was the National Rural Health Association working with a reporter and really capturing what would have happened or what could happen based on Medicaid cuts that were being contemplated. This was a story of success. The lead in it was a family that was able to access a regional hospital. Theirs was a positive story, but it also pivoted then to the fact that that lifeline could be lost if the funding cuts that were being contemplated had been instituted. So again, this is where you're sort of taking a local story, telling that story, and then working with a reporter who then builds on it with their own reporting to tell a broader story about impact. If we go to the next example, we can take a look at an opinion piece that our team worked on with health leaders in the state of Texas during the measles outbreak. Again, this is first-person articulations of experience, of understanding what the ground level impact was of changes in policy, and also being able to point to the fact that this was an entirely preventable disease that from which a child had died. Again, these two health leaders, Catherine Wells and Dr. Wong, really were able to articulate in a personal and strong way how this played out and what the issue was in Texas. And then lastly, I referenced before long stories versus short. A single quote or a single sentence can sometimes be put to use in digital formats or in our media outreach, where we can kind of take the kernel or the crux of what someone tells us to be able to then use that in a variety of different ways. So you don't, when you think about, do I have a story to tell, you don't need to feel like it needs to be this massive thing. Sometimes it can be very succinct and direct, and we can put that in play in other different ways. So I've shared the sorts of stories that we're looking for and from where, but even if you don't think that your story fits this criteria exactly, but you think it could be helpful to the campaign, we'd still love to hear from you. We're putting up a poll now. Let us know if you have a story, a quote, or that you can connect us with someone who might, and we'll be able to follow up after the webinar. Again, you don't need to be an expert in storytelling. That's where we come in, work with you to elicit those elements, and then to be able to craft it into something that is really advantageous and beneficial to the coalition and this campaign, but ultimately is advantageous and beneficial to injury prevention across the country. So thank you so much for your time, and just give this question here a yes or no, and I'll pass it over to Liz.
Thank you, Carlos. Okay, we've got a lot of questions from you all. So Paul, most of them are for you or for Sharon. So if you two could come back online, that would be great. All right, the first question that we have is from a participant from Alabama. I live in one of the key states, Alabama, with a senator on the Appropriations Committee in those key states.
I'm sorry, Liz, you froze on my screen for just right when you were asking the question. Can you repeat it?
Sorry about that. Yes. I live in one of the key states, Alabama, with a senator on the Appropriations Committee. Any special instructions for people who live in one of those key states?
Yeah, the instructions are the same for everybody, which is, well, one thing we heard from our champions in Congress was that the CDC Injury Center was proposed for elimination last year, not because there are members of Congress who are really strongly opposed to the work that the CDC Injury Center does. It was proposed for elimination because members of Congress don't know much about what the Injury Center does. So the key thing to do is to educate Republican senators about the programs, the CDC Injury Center programs that are funded in your state and the impacts that those programs are having.
Okay, next question is on why we are including mostly calls to actions around appropriations. Why are most of the references to funding and not to the mass layoffs right now, Paul? And are we going to call for staff to be reinstated?
Yeah, so as I said, the coalition led a sign-on letter to Secretary Kennedy, formally noting our opposition to the staff layoffs. But the appropriations process is what is kicking off in Congress right now, and that is the key to funding all federal agencies and all federal programs. If we're able to retain injury center funding at its current level of $761 million, that will allow the injury center to bring back many of the staff that they have lost.
Okay, next question is, we have a couple questions about the sign-on letter that we're asking members of Congress to sign. Is there a list of folks who've signed the sign-on letter already so that members of the coalition can thank them? That's the first question, Paul.
Yes, absolutely. I will see if I can grab a link to the Action Center on the Safe States website, where we have those House members that have already signed on noted. I'll just say that the Senate letter just started circulating yesterday, so we don't yet have a list of signers on the Senate letter, but we have a preliminary list of representatives who have signed the House letter.
Okay, great. And then the second question that we're getting is just how to reference the sign-on letter in the letter that we've drafted, and if it's possible to tweak the wording a bit. Could members of the coalition simply refer to it as the CDC Injury Center Dear Colleague letter?
Absolutely. And I love the question because, yes, please edit these letters and these emails to put them in your own voice and to feature those injury center programs that you care about most. But everybody on Capitol Hill, particularly now, knows what a Dear Colleague letter is. And so if you reference it just like that, they will know what to look for.
Okay, next question. We've got a couple storytelling questions. With so many alarming things happening on the federal level right now, and lots of folks competing for legislators' attention, what are our suggestions on how the members of the coalition can cut through the noise? Maybe first, Paul, do you want to take a stab at that one?
Sorry, Liz, I was going to grab the link.
Oh, that's okay.
Give me
Or
the
Sharon.
question real quick.
How right now it just feels like there's a cacophony of alarming things happening on the federal level. How do members of the coalition cut through the noise and stand out with so many different coalitions competing for senators' attention?
Well, no, it's absolutely right. I mean, there is an onslaught of news coming at us, an onslaught of different policies that are being implemented by this new administration. But what's amazing to me, and I've heard this from other colleagues, when I and others meet with these congressional offices, oftentimes the onslaught has hit them the same it has us, and so they are unaware that the injury center has been proposed for elimination. Meetings I've had with congressional staff where they have said, I had no idea that this was in the works. Thank you for providing this information. So there is an onslaught, but if we don't speak up, we will just get lost in that overall noise.
I would.
Yeah, oh, please go ahead, Sharon.
I just wanted to add, even though it feels like you're being a pest, keep reaching out and keep following up. We've seen success when, you send the initial note and you probably won't hear anything back because they're getting a million emails, and then you follow up on that and you follow up on that. And it gets on their radar, keeps it up at the top of their inbox if you're using email. So don't feel bad about multiple follow-ups.
Yeah, and the thing that I would add too is it is the combination of the story that's being told, but also the targeting that's being done to get that into the right people's ears at the right moment. And so it is that combination of arming folks for these types of meetings and conversations, but it's also in terms of that earned media engagement where we sort of take those things and get them to the right reporters at the right moment. So it's that combo of story and targeting.
Carlos, next question is around storytelling too. So we've got a couple different questions. Some folks work on issues such as sexual violence, child abuse, neglect prevention. Are those stories valuable to this campaign? Would you want to hear from those folks too?
Yeah, I would say at this stage, if we can find some sort of a connection to the injury center, we want the funnel kind of as wide as possible here at the beginning to be able to contemplate these. And I also think too that sometimes think about this type of work as gathering string, right? We're gathering string for something that we're going to knit together into a story. And it may be that a component of that type of story gets woven together with something else. So I would lean towards have your bias be towards sharing the story idea, and then letting us think about how best to stitch it together with other stuff and to use it. We do want stories that have potential bipartisan impact. We want to be able to tell stories that we think are going to resonate with those key decision makers on the Hill. But we are definitely open to this broader approach at the beginning, and then we'll sort of narrow things down as we get a little bit more surgical along the way.
That's great. I mean, I'm thinking about members in particular who have sort of staked some of their legacy on some of those issues that were mentioned by that one questioner. Murkowski, Collins, for instance, have a long history of acting on those issues, and we know want to continue to support them. Another question that's asked, Carlos, is what about stories about losing someone or a personal impact from violence or injury? Is there a way to incorporate those stories into the messaging about the importance of prevention?
Yes, and I'll say that, sadly, injury prevention work often or sometimes lands on these stories of pain and loss. But many times the pain and loss leads to resilience in someone or a recommitment to working on those issues to ensure that others don't suffer the same fate. I can think of very specific stories that we've already gathered and talked with folks about is stories of personal loss, but then people putting that to work in their professional sphere. Whether it's educating people about those, committing to building foundations, for instance, that try to elevate those stories. So, we will receive those stories with sensitivity and with understanding and work with you on the best way to convey those stories of pain or loss. But we do try to look then for what does it teach us about what can be done in the injury prevention field to ensure that others don't experience that down the road.
All right, we're almost out of time. Last question is for Paul. Paul, we have a question from Holly Billy, who's with Tribal Public Health. And she is curious if you're interested in engagement from tribal organizations and if you could potentially connect together tribal organizations that are interested in engaging.
Yes, absolutely. Yes.
Wonderful. Okay, so I think we'll conclude the Q&A there. We just want to remind everyone that the deadline for the sign-on letter is May 16th. So we know that there's not much time. We called this call with you so that you could act urgently. And we put together the toolkit to hopefully make it really easy and simple to engage with your members of Congress. So just a reminder that May 16th is the deadline for you to ask them to sign on. And then we're going to close the loop with this group and check back in on June 3rd for another webinar We would love for you to come to that webinar with lots of feedback on how it went with the toolkit, maybe some stories about how you engaged from members and what you heard from them. And if you have questions in the meantime about how to use the toolkit or how to engage with your member of Congress, you can contact Sharon or Paul, and their email addresses are on your screen. Please speak up and let us know what you're hearing and how it's going on the ground. We want to thank you all so much for your time. We know that you are all super busy, and thank you for your partnership. We will see you in a few weeks on the next webinar on June 3rd. Thanks again.